Earlier I spoke to Professor Steven Riley. He's an epidemiologist at Imperial College London and is a member of the group which models the pandemic for SAGE and an author of the REACT study. I began by asking him if he was surprised at the drop by a third in infections in England reported in his study.
I'll be absolutely honest, I didn't know what to expect personally. It felt very different to the first lockdown that started at the end of March. And we were just our study was running towards the end of that period and we got to see some of that. This was not as rapid a decline as we observed during the first lockdown, but it was very reassuring that there was a substantial decline. Have you been able to interrogate this at all? I mean, have you been able to, for example, even talk to people in the regions where things were worst? We've not had the opportunity. We've been able to interrogate the data and look drill down into deeper and deeper patterns. But we can see that in the northern regions that were at the highest prevalence, that's where the most substantial declines have been. And then in the southern regions where we were worried that they would have sustained rapid growth, they've not had as marked a decline, but they've certainly not progressed through to those very high prevalences that we've seen in the northern regions in recent weeks and months. I mean, it's a very crude question, but is this kind of a lockdown really the only answer? I mean, it's the most dramatic effect anybody's had yet. Is it the only really serious piece of armoury we have until the vaccine dawns? We're going into a period now with more stringent tiered interventions. And we've got a couple of weeks before the Christmas period starts properly. So I'm really hoping that there's no rebound during that period and we can show that these more stringent tiers do work. And of course, when we come to the vaccines, we don't actually need to vaccinate everybody in the country, do we, to achieve herd immunity? No, that's right. And the first priority will be to directly protect people. So if we have effective vaccines, we know who are most at risk of severe disease and who are most at risk of infections. And I believe it's very clear that care home workers, healthcare workers, and those most at risk by age or other factors will be vaccinated first. So that direct protection will work. We'll get that to work as quickly as we can. Then after that, we start to think about indirect protection, which what you've mentioned. Once we have a large enough proportion of the population who can't transmit, then the rest of the population does get protection. But at the moment, the vaccines have not been measured. That we don't know for sure how much they protect from onwards infection. The way the vaccine efficacy is measured at the moment, it's about protecting the individual. And if I ask you a crude question, which is this the first time that you've really felt optimistic about the work you're doing and the results you're achieving? I do. The efficacy of the vaccines, the first 3 vaccines that have all been shown to be effective, has been much greater cause for optimism than anything else we've had during the pandemic so far. Professor Steven Riley, thank you very much indeed for talking to us. Welcome.
Now, in the seesaw of lockdowns, Wales is due to tighten up as England loosens up a fraction. Although Wales entered its second firebreak lockdown before England, cases have been rising alarmingly since it was lifted. So from Friday, all indoor hospitality will close at 6 p.m. and no alcohol will be served anywhere. You can still go to the pub, but it'll feel a bit like a tea room. Our Home Affairs correspondent Andy Davis is live for us in Cardiff with all the details. Andy.
Well, while the debate continues in England over the tier structure which kicks in at the end of lockdown, the announcement here in Wales perhaps illustrates how important it is to get it right when you do eventually emerge from lockdown, because you do get the sense from the Welsh Government that they are now regretting not having lifted restrictions more gradually when the firebreak lockdown ended here 3 weeks ago. Cases, we're told, are rising at an alarming rate. And this was the First Minister speaking at his press conference earlier today.
The advice we have from our scientific and medical experts is that by the 12th of January, the total number of people with coronavirus in hospital in Wales could rise to 2,200. And our modelling suggests that unless we act, between 1,000 and 1,700 preventable deaths could take place over the winter period.
Now, the upshot is that in addition to the existing restrictions, all bars, restaurants, cafes and pubs will have to shut by 6 p.m. and they won't be able to serve alcohol, similar to the level 3 restrictions you can see in parts of Scotland. But up to four people will still be able to meet in venues in Wales from 4 different households. That aspect doesn't change. Indoor entertainment and visitor attractions such as cinemas, galleries and museums will also have to shut. There'll be a £340 million support package, said the Welsh Government, but you can imagine the sort of response this has elicited from the industry today. Soul-destroying is how one business owner put it tonight. Another bar and restaurant chain has said it's just going to shut while these measures are in place, given how critical alcohol sales are to its operation at this time of year. CBI Wales issued a statement saying it's devastating for a sector that's already reeling from a damaging cycle of restrictions. And they and others are now making the point that for these businesses to have any chance of survival, this funding package must be distributed fairly and quickly. The Welsh Conservatives have criticised the Labour government here for adopting a Wales-wide approach. They'd prefer it if it was targeted in a much more localised fashion. But the Welsh Government is sticking rigidly to its belief that for these measures to be most effective, they have to be rolled out on a national basis, regardless of any geographical variations in infection rates. So these new restrictions come into effect from 6 p.m. this Friday. They'll be reviewed on the 17th of December, and we're told also to expect an announcement later this week on travel restrictions.